We're talking today about new developments in treating lung cancer. We're here at Hematology and Oncology Associates of Northeastern Pennsylvania on Mead Street in Dunmore with Dr. Jeffrey Grin. Dr. Grin, thank you so much for joining us.
Thank you. Thank you very much.
So when it comes to these new treatments, I understand personalized treatment is very, very important. Can you explain why?
It's an exciting time. It's something new in lung cancer. We learned that some patients respond to chemotherapy and some patients don't. Now we know why, and we can test their tumors for specific problems, specific gene mutations to say what they're going to respond to. So all of a sudden patients are not getting all the same thing. They're getting individual treatments based on actually testing the tumor for specific markers or gene mutations.
Now, those new treatments that you're talking about, can you explain those a little bit more and how they could potentially help a lung cancer patient improve?
The specific mutations cause the tumor to grow. They're the driving force that makes the tumor grow fast. And the specific treatments now are sort of like a lock and key. They fit into the mutation specifically for that patient and stop it and freeze it up so that it stops the tumor from growing. These treatments don't have the same side effects as many other ones, and they're much better tolerated.
So it sounds like, some hope is there with something that can be very, very severe, like lung cancer. Now, in terms of screenings, can you talk a little bit more about what's being done there?
Screening is a trial that has been going on throughout America for many years. It has just recently been increasing in the Northeast PA area. We try to screen patients who are at high risk for lung cancer. That is basically smokers. So patients who have been smoking a pack a day for over 30 to 50 years are at risk for lung cancer. They get a specific kind of CAT scan that their physician can order that gives low doses of radiation, so you're not exposed to higher doses of radiation like a regular CAT scan, and they look for early tumors. These tumors are very important because early ones can be cut out very simply, whereas later ones, once they become bigger, they start spreading and they can't be cut out or cured.
Now, Doctor, you mentioned the importance of screening early on. What are some warning signs that people may experience that could indicate they may have lung cancer and should have it investigated further?
That's one of the problems. There aren't a lot of early signs for lung cancer. Folks who smoke often have a cough on their own or some breathing difficulty on their own, so there are no specific signs. That's why we screen patients who have no particular findings. We screen them based on their history of smoking rather than on their symptoms.
Now, for those that are interested in finding out a little bit more or, may want to get screened here at Hematology and Oncology Associates of Northeastern Pennsylvania in Dunmore, what's the best way to get in touch with someone here?
The best way is to call us. Our phone number is 570-342-3675, or your family physician.
All right, and of course you could also visit them on their website, cancercarenepa.com. Dr. Jeffrey Grin from Hematology